Hello, everybody, and good morning if you're on the West Coast. My name's Emily Goldberg, and I'm a genetic counselor at JScreen. And I'm so glad that you could join us for our webinar today, which is called Know Before and Not After. And I really want to thank Cancer Schmancer. They've been such a great partner in our combined mission of preventing cancer. And this is always something that's so important, but especially now it's on our minds because it's Breast Cancer Awareness Month. So I think what we're going to do today is to share some information about cancer genetics. And then you're also going to hear from Jennifer Levin, who is my partner today. And she's a breast cancer thriver and advocate. And our goal is to really share information that you can use to be proactive about your health, whether that's genetic testing or just starting to take action and think about talking to your families about the history of cancer. So let me jump in. So just to give you a little bit of a background. So JScreen is a national nonprofit. We're based out of Emory University in Atlanta. And our goal is to provide genetic education and awareness, as well as genetic testing and counseling. And so one of the things that we'll do today is, aside from hearing a little bit about genetic testing, is we want to give you the opportunity to actually do genetic testing yourself if it's something that you're interested in. And so we have a code at the end that we'll be sharing with you that will allow you to come through JScreen at no cost if it's something that you're ready for. Now, because it's Breast Cancer Awareness Month, you may have seen a statistic like this, and it's staggering. 1 in 8 women will be diagnosed with breast cancer at some point in their lifetime. And what if there was more we could do to prevent cancer or to detect it at an early treatable stage? And being our own advocate and thinking about cancer genetic testing is one way to do that. So I'm going to give you a little bit of a genetics lesson, so bear with me. Now, everybody has genes in our bodies that have all these different functions. So genes tell us what we look like, how tall we are, sometimes what diseases we might get, and our blood types. And some of these genes are there to protect our bodies from cancer. So they're our natural protection. They're like security guards. They're on the lookout for our cells acting up, and they try to stop cancer in its tracks before it can. Now, sometimes in a family, we find that one of these genes doesn't work right. So we lose some of that protection, which means we may be more susceptible to certain types of cancer, depending on what that gene is and what it should be doing. Now, the most common and the one that often people have heard of are genes called BRCA1 and BRCA2. And for people who have genetic changes in these genes, they're more likely to develop certain types of cancer, most commonly female breast cancer. And a woman's risk can be as high as 85% in her lifetime. And there's other risks as well, including ovarian cancer, pancreatic cancer, prostate cancer, and melanoma, which is a type of skin cancer. And so the idea behind this testing is that if we know that somebody has a higher risk for these, there's more we can do in terms of screening and prevention. Now, even though BRCA1 and 2 are the most common hereditary cancer syndromes that we see, we know it doesn't account for everything. There's a lot more genes that also contribute to cancer risk. And there's actually other cancers aside from breast cancer that we can also see running in a family. So sometimes there are patterns that we look for, like if we see breast and ovarian cancer together in a family, or there's prostate cancer or pancreatic cancer with it. And so it's important to really think about all the different cancers in your history or in your family and not focus on breast cancer alone, although that certainly is a big piece of it. Now, what's the point of genetic testing, right? So somebody can do genetic testing and learn about their risks, but the point is really that we can use that information to feel empowered and make changes to our medical management. Now, for breast cancer, that could be things like starting screening at an extra young age, or doing more frequent screening. So instead of yearly mammograms starting at age 40, somebody might do a combination of mammograms and breast MRIs, and they might start at 30 instead of 40, depending on their genetic testing and their family history. Some people will have surgery to remove both breasts as prevention to dramatically lower their risk for breast cancer. And as you can see here, there's a lot of other options for screening and preventive measures for other types of cancer as well. Now, there may be people watching or people in the family who have already been diagnosed with cancer, and I don't want to discount the benefit of genetic testing for people who have had cancer in the past or who already carry a diagnosis. And that's because genetic testing can often help people make decisions about what surgery to have. For example, somebody may be thinking about a lumpectomy versus a mastectomy or a bilateral mastectomy. It may help them choose different medications and targeted therapies depending on their genetic status, and to use the information to think about the future as well. If somebody has a genetic change, they may be more likely to develop an additional diagnosis in the future. And so by knowing this information, they can use that to think about screening and prevention down the road. Now, genetics is sort of an interesting field because it's not just about the one patient in front of us, right? We share a lot of our genes with our family members, so it's really a whole family affair. And most of these genetic changes are passed from parent to child. So if a parent carries one of these changes, then for each of their children, it can be a 50-50 chance that they also inherit that change. So it can be really powerful for family members to know there's something in their family so that they can then seek their own genetic testing and use that information to make their own medical management plan. So when somebody learns about their genetic risk, one of the most important things that we tell them is speak to your family members, let them know this is going on. And, next month we have Thanksgiving. Everybody's around the table to really ask the questions. Who in the family has had cancer? What type it was? How old they were? Has anyone ever had genetic testing? Because that can really play into our risk and our decision to get genetic testing or changes to our screening, even if we don't find anything genetic. So it's important to know for everyone about the family history, if they have that information, to make informed decisions about their screening. Some people who find out about their genetic status at a time when they're planning to have children or to expand their families might also use this information to plan how they want to have kids. So for example, if somebody carries a genetic change in BRCA1, they may decide to go through in vitro fertilization. You can actually do genetic testing on embryos to ensure that it's not getting passed on. So this may be something that people consider at the stage when they're planning a family and they want to know what they're at risk for and what they're at risk of passing on to their children. Now, I want to highlight a few misconceptions because these are some of the most common questions that I see. And while we're on the topic of questions, you may notice there's a Q&A button. So feel free to put in questions, and Jennifer and I are happy to go through these at the end if there's anything that we miss. So the first one is, I don't need genetic testing if I've already had cancer. And I sort of mentioned this previously, that genetic testing can help inform treatment plans and also whether there's anything to be worried about for the future. Another thing is not to forget the men in the family. So men can get breast cancer, although it's not as common. And some of these genes are associated with other types of cancer that can affect men too, such as colon cancer, prostate cancer, pancreatic cancer. So it can have implications for their own health and screening as well. And men and women are just as likely to carry these genetic changes. So don't ignore dad's side of the family because you think breast cancer can't be inherited from dad's side. These can come from men or women. They can be passed on to men and women. So it's really important for everyone to consider testing. Another one is that you may think you don't need genetic testing or there's no hereditary risk because it's not in your family. And we know that most women who are diagnosed with breast cancer actually don't have a family history. And we think probably about half of people with a hereditary cancer syndrome don't meet traditional criteria for testing. So in other words, their families don't look like they have tons of cancer and may not have otherwise been candidates for genetic testing. There are also people who have small families, or they're mostly men. So maybe it hasn't popped up. So I encourage for anyone who has a family history, if they've had cancer themselves, or maybe they're missing a piece of their family history, and they just want to know for themselves whether or not this is something that they carry, I encourage you to think about testing. And for people who have had testing in the past, our genes never change. We're born with them. Once we have them, we're set for life. The only thing that does change is our technology. So if somebody had testing for BRCA1 and 2 genes, and they had testing in the past and it was negative, then we don't expect one day for that to change. However, there's so many more genes that we can test for now. There's more that we've learned. So if you've had testing in the past and it was not a full panel of genes, then I'd encourage you to sort of circle back and think about updating your genetic testing to make sure that it's comprehensive and it covers a lot of the genetic information that we now know about that we may not have known at the time. For anyone that's interested in coming through JScreen, all the testing is done from home. So you go online to our website, which is jscreen.org, and there's a request a kit button. So we'll have you fill out some information, answer some questions about your family, and we send out a saliva tube to spit into. And then once the results are ready, you'll meet with myself or one of the other genetic counselors to go through your results and all the information. So we walk you through the process, we explain everything about your results and any next steps that we may recommend. Now this code, and we can put this in the chat as well, as I said, because it's Breast Cancer Awareness Month, and because we're just so happy to be partnering with Cancer Schmancer for this educational event, we want to be able to offer attendees testing at no cost. So you go onto our website, request your Cancer Gen Kit, and put in this code at checkout. So it's Cancer Gen Free Screen. It's all one word, and it'll make the testing no cost for you. We do ask for your insurance information and your doctor's information, though if it's not covered by insurance or there's any other out-of-pocket costs, you won't be responsible for it. So our goal is really to get awareness out there, spread the word, and to consider genetic testing if it's something that makes sense for you. Again, feel free to put any questions in the Q&A. I'm going to pass the microphone over to Jennifer so she can take it from there.
Good morning. Thank you, Emily. Can everybody hear me okay?
There you are. I can see you and hear you.
Okay, great. I can't see myself, but here we go. Good morning. My name is Jennifer Levin. Thank you, Emily, for giving me the opportunity to share my story. In 2015, I was living a healthy lifestyle, didn't have any symptoms, normal checkups, physicals, went in for a routine mammogram, and they found suspicious calcifications, which I followed up with an ultrasound, which found 1 tumor, followed with an MRI that found 4. So I had a very aggressive type of cancer and did 2 years of chemotherapy, radiation, surgery. And it really changes your entire life when you have to go through all those steps. When you're in the middle of it, your body breaks down, but years later, you're still suffering from all the effects of chemo and radiation, which is why I feel so passionate about getting these tests done. Mine was not genetic, but there are a lot of genetic cancers out there, and having the ability to catch cancer at stage 1 and 0 is 100% curable. And your chances of having chemo or radiation are very, very small. And you can go on pretty much living a healthy life. I lost my best friend last year to pancreatic cancer. She had a gene mutation. She did not do testing. She was the young age of 49 years old. So basically, I talk to people a lot. I talk to women at least once or twice a week that find me through social media or just through word of mouth that are newly diagnosed with cancer. And I'm finding that a lot of these are the BRCA. These women are very young. And when they're young, they do have a very aggressive form of cancer. So I think it's really important to be proactive, to always see your physician, do your yearly physicals, find out if you're deficient in certain vitamins, to take those, get imaging done when you start at the age of 40, to get the mammograms, to do the testing. And I really think it's important to do this as well. So thank you so much for letting me speak. If anybody has any questions, I'd be happy to answer.
And thank you, Jennifer, so much for sharing your story. I think it's such a good example about how, we have to think about our own health and be proactive and be our own advocate, especially if we feel like there's something going on. We know our bodies and we have to listen to our bodies. And I think Breast Cancer Awareness Month is a good time to sort of think about some of these things and not just learn, but also to take action, to sort of take those steps, to be proactive and think about what we can do to improve our own health. All right, so I just want to share my screen for one more minute, so that way everybody can see that code. Oh, and I think there's a question, hang on. Okay, so there's a question about lifestyle changes that we can make when we discover a predisposition to cancer. And I think this is a really great question. So there are things that we can't change. We can't change our genes, right? We can't change the air that we breathe when we're on the train. But there are things we can do, like not smoking. We know that's a big risk factor. We know that drinking a lot of alcohol contributes to breast cancer risk. We know that eating well and exercising all contributes to staying healthy. So when with a hereditary cancer genetic change, it's not a cancer diagnosis. It means that their risk is higher, but it doesn't mean that they'll develop cancer. And so while we can't change the genes that we're born with, we can still do other things. We can change our lifestyle. We can make sure that we are eating well, exercising, not smoking, staying away from other things that we know contribute to cancer risk. And then also being on top of our screening and making sure that we go for the mammogram when it's time, or we schedule that MRI, or we think about the options for preventive surgery. So there's a lot that we can still do to be proactive and to lower our risks. Any other questions anyone wants to add? Yes, so there's another question. Are certain ethnic groups more prone to genetic factors? Yes, so one of the most common is for people who have Ashkenazi Jewish inheritance. That's people who are Jewish from Eastern Europe, are much more likely to carry a genetic change in BRCA1 or 2. And we expect that about 1 in 40 Ashkenazi Jews carries a BRCA1 or 2 mutation, even regardless of family history. So even if they don't know anything about their relatives, or they have a big family and nobody's ever been diagnosed with cancer, they have a higher risk just based on their background alone. So it's certainly something for people to consider if they have Jewish background, how that plays into their risk, and should they want to seek genetic testing, even regardless of background. Another question is if people need to have a certain history or meet criteria to come through testing at JScreen. And the answer to that is no. So historically, genetic testing was only available to people who had X number of relatives with cancer, or they were diagnosed at a certain age, or there was a very particular box that they fit into. And so at JScreen, our goal is really to make testing as accessible as possible. So for people who don't have a family history and they just want to know, or they're adopted, or there is cancer, but nobody's ever had genetic testing before, our testing is available to everybody, regardless of ethnic background, regardless of their personal and family history of cancer. And I think one last thing that I just want to mention is that sometimes people avoid genetic testing because they might be scared of finding out the results and finding that their risks might be higher. And that's totally valid. But I also encourage people to look at this information as empowering. That if you carry this genetic change, you've always had it. It's always been there with you. But once we know about it, there's more that we can do to be proactive, to lower your risks, to be able to offer you the screening and preventive measures, because our goal is really to keep you nice and healthy. And the same thing goes for your family members. Okay? So it's certainly a big step to think about genetic testing, but it's a good step to take to really take charge of your health. Another question is, what type of cancer does the testing screen for? So we're giving a lot of attention to breast cancer because it's October, but our genetic test, it actually looks at a total of 63 different genes. So that includes BRCA1 and 2, but a whole host of other genes as well that contribute to more than 40 other types of cancer. So maybe you're watching and you say, you know, there's really no breast cancer in my family. It's not something that is as high on my radar, but there's a lot of colon cancer in the family, or pancreatic cancer, or kidney cancer. Genetic testing looks at a lot of other types of cancer as well. And often we can make recommendations for many different types of screening and prevention. And Jennifer, it looks like there's a question for you. And it says, what changes did you make after your cancer diagnosis?
So the first change I made was de-stressing my life and really getting to the root of what was causing stress. I learned not to sweat the small things. I changed my entire diet, the way that I eat, the way that I live. I only eat organic. I do my blood work every 60 days. I supplement. I probably take 30 supplements a day. I feel like I'm constantly going to the doctors, getting tests done, making sure if I don't feel good, I don't wait on it. I always have a 2-week rule. If it's still feeling the same way for 2 weeks, I go in, I don't wait. I think everything I put in my body, I really think about just diet, exercise, and low stress. I think that is a big, big deal. And vitamin D too. And vitamin D was a big change for me. I was very deficient in it. And I was somebody that was taking a multivitamin every day. So I think just being on top of it with blood work and eating healthy.
Amazing. Thank you so much. And while I'm sharing my screen, just to get that code back up there, I do want to just remind everyone that this testing and all this information is useful for both men and women. So if you're watching, thinking about not just your daughters, your moms, your sisters, your aunts, your friends, but also your nephews, your brothers, your dads, because this can have implications both for men and women. And often, especially this month when we're focused on breast cancer, we can often forget about the men in the family as well. All right, so I think everybody should be able to see that code again. So again, you can go to our website at jscreen.org, choose the Cancer Gen test, and put in your insurance and your doctor's information. And then when you get to the checkout, you put in Cancer Gen free screen, and that will reduce the cost of the testing to $0. And if there are any questions that come up, let us know. I realize that the expiration date on here, I switched it. This code is good for the end of the month. It doesn't expire today. It expires on the 31st of October, on Halloween. So you have a little bit of time. And our genetic counselors are here. Should you come up with any questions, feel free to contact us. Again, I want to say thank you so much to Jennifer and to Cancer Schmancer for giving us this platform.